The onset of chest pains is scary for anyone. For Ross Dalley, the situation is a little more complicated. Ross lives in Twillingate, a remote fishing village on the northeastern tip of the island, 5 hours by car from St. John's. And his symptoms are complicated by a rare chronic condition, hemophilia.
Hemophilia is of particular concern to us as health providers here. Our catchment area is about 7,500 people. The number of hemophiliacs we have on file is about 120. We have probably the highest per capita incidence in the world.
In day-to-day life, I try not to let it affect my way of life. I try to continue on with life as if I didn't have it. But of course it does have its complications health-wise when we cut ourselves or get a bang, and especially in the joints we bleed a lot.
But in healthcare terms, Ross is a lucky man, and he knows it.
Well, actually, one would think, like living in a rural community like this, that we would be at a disadvantage with the healthcare system, but for us it's been more of an advantage.
And that's because Twillingate is one of Newfoundland and Labrador's 8 regional primary healthcare enhancement sites. Here, they link healthcare professionals using a team-based model for the management of chronic disease. The Health Council supports the ongoing expansion of these innovative models here and across the country.
The opportunity to have a social worker, community health nurses, the public health nurse, all under one roof allows us to cross-consult, and it prevents patients having to travel large distances. And it has really integrated and fine-tuned the delivery of care for our region. So the concern that this could be chest wall pain or costochondritis has also arisen. He's going to have some routine blood work done today, and he also has an appointment to see the physiotherapist so we can just work through the costochondritic end of things.
Assessing the root cause of chest pains in a hemophiliac is complex, and so patients like Ross move seamlessly through the clinic to ensure a correct diagnosis.
You were having a few episodes of chest pain recently?
Yes.
How long has that been happening?
After the initial consult, he walks down the hall where they can perform advanced on-site blood tests. Here, they check Ross's factor VIII levels, critical in monitoring the health of hemophiliacs. From there, his next stop is a visit with Nadine McAvoy, a physiotherapist who comes to the community once a week from Gander, a large center 2 hours away. Not only does Nadine help the team with the assessment of Ross's chest pains, but as part of the primary care model, she stresses prevention and patient education.
I gave him some instructions on what he should do for joint protection, and he can go further after he's been cleared of any cardiac pathology.
Okay, great. So
some people with hemophilia or with diabetes, there's such strong family history components of certain diseases that they kind of feel that, this is what they have to put up with. But with education, they can realize, well, no, there's complications that you can avoid by taking certain steps.
We quickly discovered that in order to assure the best possible care for our hemophiliacs, that not only did we have to rely on our local team approach, but that we had to outsource some of this delivery. Some pointers as to where we would go next.
When they need help with diagnosis and treatment of patients like Ross, they link up by teleconference with the leading provincial hemophilia expert, Dr. Mary Frances Scully.
So I don't know if Ross has had many bleeding episodes in the last year. I haven't heard of many. Has he had many acute bleeding problems that you're aware of?
Absolutely,
her team also visits twice a year to do advanced research on this unique population.
They were able to reassess all of our hemophiliacs, bring us right up to speed on current therapies, and that's been a real success story for us now.
They have all sorts of data on them. They know the required treatment for each patient, and if we have a problem, it's just a matter of picking up the phone and calling into Dr. Scully's office, and they usually have all the answers that we need.
If we're going to save Medicare, we should feel comfortable to work jointly as health professionals and communities and not focus too much on the curative.
That's right. All the needed treatment and everything is always readily available. I'd feel more confident here at this hospital than I would in anyone in Newfoundland.